Hi, everyone, and welcome back to the newest episode of Prenday Talks, our series of conversations diving into some of the most important and yet overlooked topics affecting recurrent bacterial vaginosis and yeast infection patients. Today, we're going to dive into the nutrition of vaginitis with Amy Shapiro, a New York City-based dietitian who's been in practice for 15 years, helping patients live their fullest lives with the help of nutrition and diet. We will be talking about everything from gut microbiome to inflammation to the foods that you should eat on a daily basis. So Amy, maybe we can just start it off. Tell us a little bit about yourself and how you got into nutrition.
Sure. So I have been practicing in private practice for 15 years now. I went back to be a dietitian as a second career. I worked in corporate for 8 years, and I was interested in all of the things, but I didn't fully get, into it. And so then I decided I had to go back to school. So I went back to school for 5 years. Wow. I got my master's in clinical nutrition, worked in the hospitals for a bit, and I just love the fact that food can be medicinal and helpful and help people to feel incredible. And I always said, I feel really good when I wake up, and I've always had a really healthy diet, just the way that I was raised. And I just always felt that people don't know how good they could feel until they feel good. So that's where my passion became. I went back to school, and now I just, love what I do. So there's nothing better than loving your career, right?
Yeah, that's incredible and really resonates. I think even within my family, like watching my parents change their diet over time, and you see them, how they feel when they wake up and you're 8 years old versus now I'm like 21, and everybody just feels so much better. So the power of food just, certainly cannot be overstated. And
Absolutely.
I think that, when we think about healthcare in general, we often think about medicine. We think about, I need to take this medicine to prevent, or I need to take this medicine for acute relief. And so what often people forget about, or, don't feel comfortable or empowered enough to change, is their diet. So I think a really interesting place to start the conversation would be how you kind of broach a new client relationship and teach somebody how they can try different things, especially people who are maybe not as encouraged or excited about changing their diet, because it's just such a daunting thing to do.
It is. I do find that it is the last thing people really want to do, right? New Year's resolutions, everybody's ready to go to the gym and they're ready to get sweaty. And I always say, with nutrition and diet change, it takes time, right? Where you can go to a gym class and exit feeling better immediately because you sweat or you dance to great music. Like there's that immediate gratification. Whereas with nutrition, you have to eliminate some things, sometimes some of your favorite foods. My whole approach is I always want to introduce something else that's going to make you happy, but you have to change your ways. And people really don't want to let go of some of those ways, especially because food is also emotional to many people. And it's scary and it's daunting, and does it mean forever? And these are big thoughts. So when I work with my clients, we first get to know each other, because building trust is really important, because I want my clients to know that I'm doing what's best for them, not just because I know it works scientifically and, here's the one thing that works. So we build trust. I explain why I'm making these recommendations, so why it will help, not just because I want to make you miserable or sad. We also sometimes leave in things that are, like I always say, I never touch anyone's coffee or Diet Coke behaviors right away, because those are really deeply ingrained. So I always, we start slow, but there's always a goal at the end. And I do find that individuals who have a clinical or medical desire to come see a dietitian usually have great results, because they know that the change can be made with the results that they're looking for, as opposed to a vanity project. Those sometimes are a little bit more difficult to, support from the client standpoint, because there's not that urgency from pain or discomfort that they're going through.
Definitely.
A different kind of pain and discomfort, I guess.
And that makes sense. And we'll actually come back to the, Diet Coke behavior that you said a little later on, because, one of the things that we'll talk about, are, high sugar foods, processed foods, Absolutely. Which we want your take on. And I actually want to pause there, because you mentioned about the, the motivation, I guess, that comes with having a medical condition or an underlying disease where if you change your diet, things get better. And I think oftentimes when we say these things, people think diabetes, heart disease, high blood pressure, like these are the so commonly known chronic diseases, but nobody thinks my yeast infections, my bacterial vaginosis, and also just generally, women's health problems, hormonal imbalances, things of that sort. So Absolutely. I would be, wanting to know, how do you approach these women's health problems from a nutrition standpoint that might be different from your experience if you went to a nutritionist to lose weight, for example?
Absolutely. So, when you're trying to lose weight, at the end of the day, it's calories in versus calories out, right? So you can do it in a healthy manner, you can do it in an unhealthy manner. But when you're trying to treat something that's as uncomfortable as bacterial vaginosis or a yeast infection, my approach is going to be, this is what works, and it's going to take time, but we're going to have to, remove certain things, add in certain things, hydrate appropriately, because these things will move the needle. So it's really me explaining the science behind it. Sometimes people don't want to know the science, and if they do, we'll get into it, and understanding why it's important to kind of stick to it, because in these cases, over time, then we can really improve the symptoms and the reoccurrence and the discomfort.
Yep, and that is what we find within our members and the people that we talk to. Reducing those recurrences is always the end goal. So you mentioned something really important, which is, taking things step by step, meeting members where they are, gaining their trust. Could you give us some examples of the recommendations that you would give to a patient who has yeast infections or BV for what she could do diet-wise to really reduce those recurrences that she
Absolutely.
sees?
Yeah. So the first thing is that to remember that everybody's an individual, right? So some things that I recommend to one individual may not work for the other individual as well or as quickly, right? Just like products, they don't always work for the right person, or the same person. So certain recommendations across the board are, right, reducing sugar. We know that for everything. Reducing processed white flours or processed white carbohydrates. We want to make sure that we are increasing anti-inflammatory foods, so fruits, certain fruits, vegetables, omega-3 fatty acids. We want to make sure that there are, sometimes we take out gluten, right, the glutinous carbs, so we want to add in things like quinoa or items that give you that same feeling but are going to help relieve or not encourage the recurrence. So what I like to say is we crowd out the less healthy foods with healthier foods, because when we eliminate something, we don't want to leave you starving or miserable.
Yeah, definitely. And I like what you said about the anti-inflammatories, because we say yeast infections, we say BV, we also just call these diseases by their symptoms. Like I have vaginal itching, I have odor, I have discharge. And, people who aren't as deep into the medical naming of it is that all of these actually come down to the word vaginitis, which is vaginal inflammation. It all comes down to the inflammation. So maybe you could give us even a detail further, like what are some of these foods that if someone went to the grocery store today, they could incorporate?
Yeah, absolutely. So what I love is that if you go to the grocery store today, we're just looking for whole foods, right?
Okay.
So if you just start on the perimeter of the supermarket, you're going to look for fruits and vegetables, right? Anything that doesn't come in a package is probably pretty good for you.
Yeah.
So we're going to start there, right? That's the first place that you enter when you walk in the supermarket. Fill your cart up with that. So things that I usually like to recommend in terms of this type of health is cruciferous vegetables. So that's your cauliflower, broccoli, kale, Brussels sprouts, the things that everybody loves.
So like a leafy green, or maybe not a green.
No. Well, some of them, because broccoli is, but leafy greens come next, right?
Okay, got
so
it.
that's going to be like your spinach, your arugula, your collards, right? Your salads, maybe. So we're going to have all of those. Those are really great. The antioxidants in there help to get rid of the free radicals, which is what causes inflammation.
Okay.
And then we'll move to different colors, right? Eat your rainbow is a dietitian's favorite saying, because that means you're getting a variety of health benefits and nutrients from the colors. And then berries, we're looking at beets, we're looking at, anything that is a whole food. That's where you want to start.
Got it. Right.
And then moving through the perimeter, we want to go to the fishmongers, right? We want to get some wild salmon with the omega-3s in there. Shellfish has the omega-3s. You want to go to the deli counter, maybe get some lean proteins. And then when you go into the aisles, you want to make sure that the foods that you're purchasing, they're going to be, again, whole food ingredients. So we want to be looking for fewer ingredients on the label, or, quinoa, brown rice, something that you recognize. That's how I would tell you to start if you're going to the grocery store.
Got it. So that's actually really great segue into one of the most commonly asked questions that we have, which is, processed foods. In our app, which is called Prende Health, right? Our members will go in, they'll be tracking not only their symptoms, but also dietary factors. And one of the things that we allow them to track is processed foods.
Yeah.
People often ask, well, what is a processed food? Are my frozen blueberries processed foods because I've now frozen them? Is it just my super white bread? Is white bread even processed? So I understand there may be a spectrum of processing that it would be helpful for people to better understand what is that and where do things lie?
Right. And that is truly part of it because, these days with there's so much wellness information out there that, peanut butter, right? Is it good? Is it bad? Well, it's a processed food because it's gone from peanuts being processed into peanut butter. Mm-hmm. And so I'd say the things that we want to be concerned with are the ultra processed foods. And actually, I believe the statistic is over 70% of young adults consume a lot of, I think 50% of their day is ultra processed foods. So that can be pretty concerning.
Yeah.
So what ultra processed foods are those foods that you probably know you shouldn't be eating, but you really like them, even if they say healthy or organic on them.
Yeah.
So there's quite a spectrum about processed foods, and what I like to say is the less ingredients in there, the better the food choice, because everything from frozen blueberries to nut butters have been processed in some form, right? Blueberries have gone from fresh to frozen. Nuts have gone from whole to ground. So those are processed. But if you look at the label, it's going to have what I'd like for you to purchase. It's going to have 1 or maybe 2 ingredients. So your blueberries are not going to have any added sugar or fruit juice to them. Your nut butter is not going to have any added sugars or palm oils, right? It's just going to be as simple as it gets. So that's how you know it is still a processed food. It's in a package. Greek yogurt is in a package, right? It would be amazing if we could all eat it from the cow, but we're not getting it that way. So those things we know are great. When you're looking and there's, ingredients that you can't, pronounce or things like hidden sugars, there's 56 different types of sugars that could be in your food, right? And so they might sound great, like brown rice syrup. That sounds lovely, but it's still sugar, right? So these are ultra processed foods. So I would say my number one rule is be a educated consumer. Read the ingredient list. Don't just assume from the marketing on the front of the box, even if it's pretty and looks really healthy and it's made from soy ink. Read the ingredient list, and 5 ingredients or less. That's my go-to point.
Yeah, so a good starting point is to look for fewer ingredients.
Yep.
And if it's not packaged, then we're probably starting off at the right spot. I'm wondering though, so for someone who's just getting started, do you often find that your new clients, you're kind of replacing all of their diet, 50% of their diet? Do you suggest kind of a gradual, maybe I start by replacing my white rice with the quinoa and then over time build it up? Or does that vary by person? What is the approach that you find
Well, if we're
to
trying
work?
to improve symptoms, I'm really going to, it depends. How uncomfortable are you? How often do these flare-ups occur, right? Do we want to nip it in the bud? Do you want to go hard and fast? Because that's like, if we want to eliminate it, we're going to commit to, removing these ingredients. I'd love to say, sure, go eat your 6 chocolate chip cookies at the end of the night because it's what you love to do. Yeah. But if you're suffering from, vaginitis, it's not really going to help. So I usually say, this is what I'd like to do, and I know that will help. But if it's a little bit scary to you, which 2 things are we going to start right now, right? So start slowly. But I would say that for most individuals, I would like to remove the processed white sugars.
Got it.
Because that's sneaky. It's in it goes in your coffee. It could be in your nut milks. It could be, in your cereal. It can be in your bread. It can be in all of these things. So that's what I say. Let's change it. But it's never a removal without a replacement.
Right. Because it's hard when to lose something mentally, we want to know, so what do I do instead? Which kind of leads into the next topic. We've brought up these white grains, super processed grains a couple of times now. There have been some studies coming out with regards to vaginitis around foods that are quote unquote high glycemic.
Yes.
And a process around, I guess, the raising of the blood sugar and that process leading to greater inflammation of the vaginal area. Could you speak a little bit to just what high glycemic means and what's happening in the body when we eat these higher sugar foods?
Absolutely. So what high glycemic means is that your body digests it very quickly and it spikes your glucose. So let's say you're going to eat a piece of white bread, right? There's no fiber in that white bread. So your body you consume it and your body breaks it down very quickly into sugar that then goes into your bloodstream, spikes your blood sugar, and then your insulin comes out and takes it up into your cells, right? So that's what a high glycemic food is. It's almost, I always say to my clients, it's comparable to, you think you're eating a piece of toast, but really you're eating a handful of jelly beans. It doesn't matter. It reacts the same in your body. So that's a high glycemic food. It spikes your blood sugar. And that is not something that we want, because that is what causes inflammation in the body. And it causes this vicious cycle of, I eat something, blood sugar spike down, spike down, spike down. And whenever you spike your blood sugar and it comes down, then you have an extreme craving, either from exhaustion, sugar craving, headache, weakness, that you then grab for something else that usually is a high glycemic food that spikes your blood sugar. Mm-hmm. So it's this vicious cycle, and you're constantly inflaming your body, which allows that vaginitis to remain and to not really improve unless you're putting this Band-Aid on it of some sort of medicine that's
and so it sounds like, even if I'm not currently in an infectious state, right? As someone who has a yeast infection, maybe I'm still not, overly candida, overly yeast, but the inflammation of the vagina persists, because it's very hard to decrease that when I'm constantly in this flux of inflammation. And so I guess that was a lot of really, really awesome sciencey work. So just to repeat it back to make sure that I understand, it sounds a lot like a sugar crash when you're little, when you eat your ice cream and you just feel yourself. I feel like when we're kids, our parents are always like, don't eat the ice cream before bed, you're going to have a sugar crash. And that's not just a silly thing to say. It's an actual bodily process where when you eat these super high sugar processed foods that you digest quickly, seems to be because of a lack of fiber, they are going to just uptake into your body so quickly and then just go away so quickly that you're left with a constant state of turmoil within your cells.
Correct. Okay. And you're looking for a quick fix again. So what I like to say about these foods is, they are, we don't want to eat them by themselves. So usually if we can pair these high glycemic foods with a food that is low glycemic, so a lean protein or a healthy fat, think, not that I'm promoting white bread, but since I use that as the example, if you just can't get past your white bread, if you put some almond butter or peanut butter or, a chicken or sliced turkey or something like that on it, you are therefore changing the glycemic load. So if you can only eat white bread, then please, no naked carbs. That's what I like to say. Don't eat your carbs naked, because once we dress them, we slow that spike.
Wow. Okay. So that's a very interesting and new way to think about the process. Just like from my own personal perspective, I've always thought about not ingredients, not the meal as a whole, but what individual pieces of food am I eating? So like I'm eating my broccoli and I'm eating meat and I'm eating potatoes, but all together, the way that those even interact with each other really impacts the effect the meal is going to have on my body.
Absolutely. In every level, you are going to feel more, you're going to not have cravings, because you're not going to get hungry as quickly. You're going to have more energy. You'll see your symptoms start to decrease. And that's what I talk with my clients about, how to set up your perfect plate for, all of this balance. So it's not just balance of what's happening inside your body, but it is your mood, and it is your cravings, and it is your symptoms. So that's part of the education that goes in. So if somebody says to me, I really can't give up my white bread, I'm not going to fight them on it. I'm going to help them to balance it, and then we'll slowly edit that out, right?
Yeah.
But
anyway. I love that, and I think that that's also something that we tend to miss within just healthcare in general, which is, you should take this medication, go take it. I'll see you back later. Just the nature of the healthcare system to kind of force solutions rather than working them within where a patient is in their life. And this also brings up another topic of balancing through supplements. At least within the vaginal health space, supplements are so common. They're like a mainstay, right? These vaginal probiotics, vaginal creams, some of which can be helpful, some of which not. I think we found that definitely varies person to person to person.
Absolutely.
I'm wondering what your suggestions tend to be around supplements and using those to balance out plates.
So the way that I look at supplements is I typically look at them as safety nets, right? So we want to get our nutrition first through food, right? But it's very rare that any individual, even myself, right, I'm very aware of what I should be eating. Every day we'll make sure to get all of my nutrients, especially because these days our soil is depleted, right? And our foods aren't as nutrient dense as they used to be. So I usually, I have like 3 umbrella supplement recommendations that I usually recommend to almost every client that walks in my door. And that's because most individuals are lacking in these nutrients. So a probiotic is one of them. Most people do not have a healthy gut microbiome, either due to the fact that they have taken excessive antibiotics even when they were kids, or now when we're coming into this post-masked scenario, right? Yeah. People who don't have a very well-balanced diet. Fiber is what feeds the gut microbiome, and if you're eating, mostly processed foods, you are not fueling your gut microbiome, so your bacteria are dying. So a probiotic is something that I usually recommend to most individuals, an oral probiotic. Right. And then I usually recommend an omega-3, because omega-3 helps to fight inflammation. And unless you are a pescatarian or eating cold water fish at least three to 4 days a week, you're really not meeting your needs.
And I doubt that's many people besides pescatarians.
Probably. Yeah. So I always say, and it doesn't hurt, especially because I won't get too scientific on you, skip that. But so the omega-3s are important because we're not getting enough from our food. Okay. And that helps with inflammation, it helps with brain health, it helps with sexual function, it helps with so many things. So omega-3s, and then vitamin D3. So what we've learned as the research keeps coming, especially with COVID, is that vitamin D for women not only helps us to uptake calcium into our bones, so depending on what stage of life you're in, really important, you could take calcium, but if you don't have vitamin D, you are not absorbing it. Yep. For immunity, for anti-inflammatory, there's so many things, and we can't get vitamin D from our food. We can get minimal amounts, right? A little bit from mushrooms, a little bit from egg yolks, but really we're not getting the dose that we need. We only get it from the sun. And so since most are not running around naked in the sun for 15 minutes, without sunscreen on anymore every single day, we're not getting our needs. Yeah. So those are my 3 go-to recommendations. I will also recommend a multivitamin to some individuals. And then we get pretty personalized after that, because everyone's very different.
There is so much to unpack there with regards to women's health. I mean, no, don't apologize. Please keep going. Within the relationship of the gut microbiome to vaginal health, also inflammation, once again, seems like inflammation keeps coming up. But
it's everything.
The one that I'll hit on first is vitamin D, because we've actually brought this up in a previous conversation in one of our podcasts, which is, people think of vitamin D and now they, think more of immunity than they did the sun, because I think COVID has changed the conversation around vitamin D. But when you think about these vaginal infections, people tend to not think of them as infections that your immune system needs to work through. They tend to think of, I just have this itching. I should do anything I can to get rid of it right now, which when itching is so acute, how are you supposed to think of anything else? But in reality, it is important that your immune system is strong and that you have the necessary, bodily capabilities to prevent those infections. And so what we've actually found in correlation studies recently is that people who are vitamin D deficient tend to have a greater propensity to bacterial vaginosis. And so what is the process like for somebody to find out, do I have a vitamin D deficiency? And then what do I do about it next?
So it's an easy blood test that almost all doctors will put in their usual lab draws. Okay. So you will see if you're vitamin D deficient, and I would say majority will come back low. Okay. And I would say deficient and low, I would still treat. And I am not deficient anymore, but I still take vitamin D every single day, because we want to maintain our levels, right? So if we're not, again, going outside every single day, we can be high, but we then need to maintain. So, it's always important to look for that on your labs, and you will see it go up if you do supplement. So I always say, test 3 months later and see where you are. And when you are low, you do meet those needs by taking high doses, right? So some people take 5,000 IU every day. Some people take 10,000 IU twice a week, but you'll be at high doses that might seem a little bit scary in the beginning, but then you can taper off and maintain.
Yeah, that's actually exactly what Kim, who was on our previous episode, said, is that she's a nurse practitioner. When her patients come in and they're vitamin D deficient, she'll give them the 5,000 or the 10,000 over a period of time. Yeah. And then retest, so it sounds like it's very consistent across the medical field, and yet so many people come to Prende not knowing about the connection or not knowing if they're, vitamin D deficient. And so it's incredibly important to understand that supplement, if used right, can definitely strengthen your body against that inflammation that bothers you so much. And it's a rather easy fix to incorporate.
Well, it is, but I always like to say, everybody, just like with exercise, everybody's very excited to supplement. Right? Because it's almost like, oh, great, let me take this and then I'm fine. But we want to say, in addition to taking your vitamin D and correcting that and supporting the anti-inflammatory response in the body and boosting immunity, you still need to focus on the foods that you're eating, because if you're eating cupcakes and cookies every day and then thinking that you're band-aiding it with a vitamin D supplement, you are helping your health on one hand, but you're probably not putting out the fire that way.
Yeah, it's a balancing act between all of the things that have their effects and what you can, reasonably do over time. I mean, if one day you're vitamin D deficient and you eat cupcakes for breakfast, like if that's the lifestyle that we start with, it will be a little bit harder to get to the end point of eating right, exercising right, supplementing right, going to the doctor when you need to. Exactly. But I think that's the goal of, just generally practitioners who want to really meet their patients where they are, which is, we'll work on your time, but I also have these milestones that I know you can hit, and I'm here to push you to do that. Right. So, I'm very excited to see the vitamin D conversation come back up. The other thing that I was thinking about was the gut microbiome.
Yes.
And that, in addition to the vaginal microbiome, recently in the past couple of years has gained so much attention, and now consumer tests are available where you can test your microbiome. So there's so much going on. Can you explain a little bit what the connection is between like gut health, overall body health, vaginal health?
Yeah, so what it is we're basically made up of bacteria, right? That's what we're learning. It's like we are, I don't know what the statistic is, but we are mostly bacteria. Okay. And it starts from birth. They say that children who have vaginal births, right, have more of the natural gut microbiome from their mother, and now they take the babies and they put them on their bodies right away, right? We're learning so much more, and we've just started, right? This is going to be a conversation that keeps going. But what it is that our microbiome, or the bacteria in our gut, in our vagina, on our skin, they help to keep the balance, and they help to keep us healthy. So in the gut, what they do is they help with digestion, right? They help with elimination, right? Getting rid of toxins. They help to support immunity, right? So a lot of the germs that that make us sick come in through our GI tract. Right. So they help with our immunity. They help with skin health, right? And they keep things balanced. And these good bacteria we're crowding out the bad bacteria, right? So we want to make sure that we are eating foods that help to support that. So there's the Greek yogurt, there's your fermented foods like tempeh, sauerkraut, kimchi, all of these foods. And we want to make sure that we keep those bugs alive. That's where the high fiber diet comes in, because these microbes eat the fiber, right? And that's what helps them to proliferate. So that's why the individuals who eat the standard American diet or these processed foods don't have a great microbiome wherever it is on your body, because your microbes can't stay alive. They've got nothing to feed off of. Okay. And sugar, right, or processed foods or white flours or all the things that cause, vaginitis and these things, they all come together, right? It's a full circle. Mm-hmm. So if we're not feeding the microbes that we're even taking, if we're taking a probiotic but we're not eating a fiber-rich diet, those microbes won't remain alive, so they won't be doing what we want them to do.
Okay, so then something I've seen has also been not just the probiotic, but also the prebiotic. Is there a postbiotic too?
Absolutely.
Okay,
yes.
So is that the life cycle of kind of feeding fiber, I guess, healthy nutrients that the probiotic needs to stay alive?
Right. So the prebiotics are the indigestible fibers of plants, right? Fiber comes from plants. So it's popular ones that people always talk about: artichokes, asparagus, these high fiber foods, but anything from, any vegetable or grain. So they are feeding off of that fiber. And when they feed off of the fiber, what they release is the postbiotic, like butyrate and these short chain fatty acids, which help to fight inflammation in the body. So this is a whole life cycle of these, but this is why we need to keep them alive. But many of us aren't, and we're seeing that when we're feeling this itchiness, we're feeling this discomfort, we're getting constipated, we're getting sick all the time. We're not supporting our body's natural immune system.
Wow. I'm just kind of, flabbergasted. I feel like everything is really coming back to the idea of inflammation. And regardless of whether we're thinking about it from the perspective of we have to feed a probiotic or like don't eat these things, like it sounds like it all comes back to making sure you can keep healthy bacteria in the gut alive, and that's going to reduce inflammation in the long run.
Correct. I mean, and the foods that you're eating are going to reduce inflammation. And what is inflammation, right? Inflammation is what causes disease. And disease can be what you said at the beginning. It could be anything from heart disease, right, to GI disruption or to vaginitis, right? These are diseases in the body. And so inflammation causes disease. And by eating healthy foods, we tamper out inflammation and we decrease the risk of disease. Not saying you'll never get diseased, right? But you can fight it or prevent it or prolong it by doing
certainly and
healthier choices.
This is another thing that I think we've gotten questions about from our members is when you have disease, especially chronic or recurrent, you're constantly on medication, whether that's like you're on the antibiotics all the time or the antifungals or heart, blood pressure medication. How have you found it to be working with patients who are frequently on medication and the impact that can have on gut health and the ability to actually reap the full benefits of nutrition?
Yeah, well, sometimes, there's so many medications and sometimes medications have food contraindications, right? There's so many moving pieces. But the goal is always, and medicine helps with so many things, but the goal is always to reduce the amount of medications you have to take. And if there is a Band-Aid medication, right, that you're taking to kind of tamper out these symptoms that you can do through food, right, then we can eliminate the need for those medications. Right. And so, or sometimes there's symptoms that come from medications. Like if you're taking a steroid, right, that can cause increased hunger and then people will feel like they need to eat more, or it can cause dehydration. So we talk about, you may have feelings, of hunger. So how do you satiate yourself through making better food choices instead of just grabbing whatever's available? Or if we're taking antibiotics, we want to make sure that we're, going through the course and then repopulating our gut with these healthy microbiome, our healthy microbiome. So it's how can we support during whatever the medication side effects can be. It's how can we maybe eliminate some of the medications, and then it's what can we maybe consume that can prevent the need for these medications.
Right. So I think a classic example is the bacterial vaginosis patient who goes back, let's say like once a month to her OBGYN, and every time she gets an antibiotic like Metrogel, for example, and so she's taking this constantly and maybe feeling side effects of like nausea, dizziness, and not to mention, I think we all know that antibiotics can wreak havoc on the gut microbiome, at least temporarily. How are you, I guess that's another question is, when you take the probiotics, would you suggest doing that at the same time as taking an antibiotic to kind of proactively build it back?
Yeah, so it's hard because, right, antibiotics are antibacteria. They are killing the bacteria in your body, good and bad. Mm-hmm. So there are some that say you can take like an acidophilus while you're taking, that's a strain, while you're taking your antibiotic, but you need to space it out at least 6 hours apart. Okay. So there's some kind of math and hours and all of that, but it's really important to repopulate when you're off of it. And you might be going back to your doctor over and over to get these medicines, but I always say, like, if you really commit to the diet, and it's not going to happen overnight, we talked about this in the beginning, but if you commit, you give yourself a month, right? And it's going to be hard, right? And if you don't want to go back every month, then you can maybe get yourself 2 months where then you say, oh, wait, I haven't been back. That's motivating to continue that. Yeah. And then you have time to repopulate your gut, right? And then you have time to decrease the inflammation. And then you have time, right? So it's almost, you
need a success to drive the rest of the success.
Correct.
Right? Like if I'm having back to back all the time and I just keep going back, I don't give myself the space, or I don't give my gut the space to get back to a point where it's strong enough to build back after rounds and rounds of antibiotics.
Right, and it takes a while. And so I always say, when you have a goal that will make you feel better and it's there, it's very empowering to really go hard and fast. So I know that we talked about how I work with my clients building trust and slow, but sometimes it will be, hey, listen, let's follow this protocol. It's going to be hard, but going to your doctor and making time to go to your doctor once a month and then applying these creams and these gels all the time, that's hard too. Yeah. Right? So maybe let's change the hard and then one gets easier.
Exactly. Crowd out the things, but also replace them, even from the behavioral perspective. And I think that's always one of our goals, is just to empower people to make the decisions that are best for them and also feel comfortable making them. Absolutely. And I think that's the importance of you and, people like you, is that if I were as a patient going to tackle this on my own, it's quite daunting, no matter the amount of information at hand, and always questions around if I'm actually doing the right thing, or if, so I'm eating quinoa, but maybe is quinoa a fad? Like, should I actually just be eating quinoa? What are some of the common myths that you have to bust with your patients to actually make the best amount of progress?
Oh gosh, there's so many.
Yeah.
Well, I think one myth is that, the keto diet works for everybody, right? Everybody wants to be on this keto diet. And the other myth is carbs are not the devil. They really aren't. The right carbs do so many wonderful things for you. And I'd say another myth is please stop drinking oat milk. That's one that everybody gets very angry with me at. But there are a lot of myths because sometimes you're getting the information from the wrong people, right? And it seems like you want to believe the big glossy new shiny thing. But how you said in the beginning, we keep coming back to inflammation. In nutrition and dietetics and functional medicine, we keep coming back to whole foods. And everybody wants something new, but we keep coming back to whole foods and olive oil and eating more fish and not eating that much bacon and watching out for eating too much red meat and not eating pretzels, right? We just keep coming back to the same thing. But everybody wants the shiny new, like, well, what should I do now? And I heard this and I heard this, but nobody's excited to hear eat more whole foods.
Yeah, it's like you've said, we've gone through so many other things. I think that also what's become popular recently is being vegan for the effects of, reducing inflammation from red meat. So how does that kind of go into eating whole foods?
Well, being vegan can be very difficult. So not to knock a vegan diet, and for those people who do follow a vegan diet, that's great, but you really need to do the research on how to be a healthy vegan because, French fries are vegan, and bread sometimes on the table, is vegan, and potato chips are vegan. And when you go to a restaurant and the only option they have for you is white pasta, that's vegan, right? So unless you are cooking at home and some great resources and to carry some nuts in your pocket for when you get hungry, being vegan can lead to eating a lot of processed, foods, including the vegan meat proteins now that are made from ingredients that are interesting, and all of these things which are ultra processed foods. They are not plant-based, so you can eat a burger that has one ingredient, or you can eat a plant-based burger that has 20 ingredients and 20 grams of saturated fat. So being an educated vegan is very, very important. So it tampers the inflammation that you might have from red meat, but it might increase the inflammation if you're relying on packaged products to meet your vegan needs.
Right. So this is an interesting thought I'm having, which is that in today's world where there's so many options for how you can eat and what you can eat, and almost an encouragement to label what it is, right? Like when you want to explain to people, I have this dietary restriction, I am vegan, or I am dairy free, I'm pescatarian. It almost feels as though to have those labels is, somewhat restricting, in that it doesn't matter what the label is. What matters is that you're eating a whole food that's going to end up not contributing to further inflammation, or maybe even better, reducing inflammation that exists.
Correct. Okay. And some of it's individualized. Some people get inflamed from dairy. If you have eczema or you have asthma, dairy might not be your friend. But if you don't have those issues, then dairy may not cause inflammation in the body, or not everybody needs to be on a gluten-free diet. But if you are gluten sensitive, that is going to create inflammation in your body. So everybody is really individualized, which is really important. That's a huge myth, right? A myth buster, like what's great for you might not be great for me, because we're different ages, we are different makeups, our different ancestry. There's so much that goes into it.
So how do you learn about these things, and what makes you if just reading a general article probably doesn't do the trick?
Well, what I like to say is, one, I like to use the elimination diet. That's our gold standard in dietetics, right? And it's hard, again. You're removing things and then slowly reintroducing them. But that's how you truly recognize what works for you and what doesn't. So you could say, well, I have a stomach ache every time I eat cauliflower, and then we do this elimination, and the cauliflower is not bothering you. It's actually that you're eating cauliflower with quinoa, and the quinoa was bothering you, right? So I like to use the elimination diet. There are tests out there. I'm not sure how valid many of them are, but there are tests. There's family history. If your mom is lactose intolerant, or if you are from a certain geographic region, sometimes, or your ethnicity, sometimes that can play a factor. But really, it's tuning into your symptoms.
Got it. Okay. Yeah, I think we've seen so many tests come around, and they test for all these different things. And one of them that I want to bring our conversation back to is, you mentioned, gluten. And that kind of rings a bell for me of a type of diet that is called the Candida diet, I think. And correct me if I'm wrong, that diet is to kind of eliminate sugars and go mostly towards vegetables.
Well, it's to eliminate processed sugars, right? And maybe glutinous carbs, to lower them. So again, we're going back to eliminating processed foods. Certain fruits are allowed, right? Because there are lower sugar fruits than others. So we would probably lean towards, more berries than we would towards melon. Vegetables more so, lean proteins, right? Fish, poultry, lean cuts of meat, eggs, those are all appropriate. Healthy fats, olive oil, avocado, nuts, and seeds also appropriate. So again, we're kind of coming back to this same, let's go towards a whole foods diet, right? And to circle back to the gluten piece, there are a variety of gluten-free options out there, but many of them are simple carbs because your whole wheat bread, you might substitute it for potato bread, which is made from white potatoes, or rice, right? So then you're getting a lot more white carbs that break down into sugar. Right. So being on a low gluten diet or removing glutinous grains means you should go to 5 ingredients of less on the crackers you're going to buy, or go from, if you're not going to eat white pasta, maybe go to a lentil-based pasta or something like that. But gluten-free, again, just like vegan, if it's packaged, just because it's gluten-free doesn't mean that it's going to be sugar-free. Right. With the Candida diet, we're trying to eliminate some of those, like wine is another thing, right? Or we're trying to eliminate foods that turn into sugar in the body.
So to bring back the Candida diet, why is it called the Candida diet? Because it sounds a lot just like whole foods, healthy foods. Why have we given it that name?
Well, I think because, again, it's extreme, right? It's eliminating, not saying just lower a little bit. Yeah. It's eliminating certain ingredients. It's recommending certain ingredients. And it's being used to treat this type of overgrowth. So some people, why we're calling it that, and I think what we do with many diets, we're just reframing the Mediterranean diet, right? But for different disease states, I guess it helps. So what we're eliminating with the Candida diet is buildup of Candida or yeasts in the body, which can happen when you have, a poor diet or overconsumption of sugars, drinking sodas, really going for it. Sometimes our body doesn't eliminate it well, and it just kind of, it thrives in the body. So we're truly trying to eliminate Candida by cutting off that sugar supply. Right. So I guess they are calling it the Candida diet because it is likely lower in sugar, with limiting fruits and things like that, which a lot of diets don't like to do, or I should say meal programs don't really like to do. But I guess that's why.
Okay. So I won't be the judge. I'll leave you to be the judge of any diet. But it's interesting to hear the word elimination of yeast, because in the vaginal microbiome, it is common for most women to have a natural colonization of yeast. And so long as it's not enough to cause you discomfort, you might have a pap smear that comes back and says you have a yeast infection, but you're living just healthily fine. So is it in fact an infection if it's just a natural amount of yeast that would naturally occur in your microbiome as a person with a unique microbiome? And so This concept of eliminating yeast is, quite frankly, impossible for many women who have just that particular microbiome makeup.
Correct. So maybe that is really, it shouldn't be eliminating, maybe it should be limiting the amount of sugar that will promote overgrowth of yeast for women who are susceptible or have this microbiome.
And I imagine it's not for women either. People with gut issues that we find to be related to Candida overgrowth or oral thrush. Or, Candida can thrive in all these different places.
Yes.
But as women and as someone who's had yeast infections, to me, yeast means vaginal infection. The ramifications are for the whole body, though.
Absolutely. And so I think it really is elimination because it's not trying to get rid of the yeast that you naturally have, but if you're suffering, then you have more than you should.
Yes.
Right. And so I think it's just, or I know that it's just giving your body less to fuel the fire.
Yep, exactly. And that's a great way to describe it, the fire of this overgrowth that all comes back to inflammation. I will leave this talk knowing that inflammation is the root not only of disease, but even just general discomfort. And I guess like physical inflammation kind of leads me to a question more about just like chaos within life, right? Yeah. And stress and mental well-being that goes down just because of life circumstances. It seems to me that stress could perhaps have effects on the gut microbiome and inflammation that can or cannot be fixed with diet. How can we use diet to really compound the effects of stress?
Yeah, so what we're learning more and more, right, is the effects of stress, the effects of sleep, right? All of these things that have nothing to do with food technically. I mean, they might, if you sleep too little, then you might reach for food to give you energy. If you are stressed, you might reach for food for emotional support or, again, to give you energy, or you might just not eat anything at all, right? So what we're, it's a full, it's almost like your life is its own microbiome of the makeup of all of these things that help you to be a well person. And I think in a perfectly curated world, we'd all sleep 7 to 8 hours a night, and none of us we would all meditate and not have stress. But there are a wide variety of individuals in this world, and many of us are not going to be able to do that. So with food, with your body, or when we're stressed, it raises our cortisol levels. And when our cortisol levels are raised, we don't take up our glucose. We become insulin sensitive. We become desensitized to our insulin, and therefore we tend to not break down or store the sugars that we're consuming as efficiently. So with stress, what we want to do, and also there are definitely things that are that go into probably another podcast, but things like adaptogens that we can take, or supplements that we can take, or activities we can, moving your body, meditating, taking a few breath work. These all help with stress, but not reaching for the junk food when you're stressed, not reaching for that fuel when you are just burning it all on all cylinders and reaching for that junky soda, but instead, again, if you're eating balanced meals and setting up your plate the right way and choosing the right foods to consume, even when you're stressed, your body will be able to handle the stress even better.
So it sounds like we're back at this process that we talked about at the beginning, right? Except it's a little different this time. The cortisol levels spike. We're not absorbing the glucose as much. Is that as different as like the high glycemic food that's big, sharp spike, big, sharp, decrease?
Right.
We're coming back to that quintessential process.
Correct.
Yeah.
Yeah.
Incredible.
And so it's one can induce stress just from what you're ingesting, and one can create stress or is a response to stress just based on your hormones. But when we eat sugar, we are affecting our hormones, right? And so these insulin spikes affect your estrogen and can affect all of these, other things. So it's just interesting to look at it, and to bring down your cortisol levels is not easy, right? So it's it's like cutting your food is not easy. So there are definitely things that you can do, and balancing your diet is helpful. And again, what will be a recommendation will be removing processed simple sugars to help reduce, what we see when cortisol is high. I see that my clients are storing around their middle.
Okay.
Because that's where we store when we have high cortisol and we have insulin sensitive, desensitized to insulin. We store in the middle. So
wow, it's so awesome to hear.
Less sugar.
Yeah. Within what you're saying, there's so many like quote unquote buzzwords that people just throw around, but I think we're like actually getting to the meat of what they like really mean, right? So I'd love for you to go back actually to the point about the hormones, because hormones are just so integral to how women and people with vaginas experience life, and they're changing every day. I mean, there's this really awesome quote about how, for men, their hormone levels are the same every single day. But when you're a woman or someone who's menstruating, you are a different version of you every single day as you go through this 30-day cycle. So is that something that you find this constant flux of hormones affects the way that women respond to food and inflammation and what they're eating?
Yeah, so I think that it, again, that depends on the person, right? And it depends on your symptoms, and it depends on your energy. But there are certain foods that you can consume to support you in different phases. But at the same time, never in any of the phases is it eat simple carbs and eat lots of sugar, right? So it's always going to be, some phases will be to increase, when you're menstruating, you're going to be increasing your iron intake. You're maybe going to be taking in, making sure that you're hydrating appropriately. And when you're, in the luteal phase or in the follicular phase, you're going to make sure you're eating more whole foods and eliminating toxins because you're creating the egg, you're maturing the eggs, or in the luteal phase, you're going to be supported. That's when your hormones are at the highest, I believe. So you're going to be, or the lowest. So you're going to be supporting your serotonin. So that's when you might eat more complex carbohydrates to support your brain happy hormones. But if you do it with the simple carbs, then we're going to be happy and sad and happy and sad, and that's what we want to avoid.
Okay, we could have a whole podcast just diving into all of those dynamics, but I'll just double click on something just really quickly, because menstruation has a really big effect on vaginal wellness, because as you can imagine, the blood has a pH of 7, maybe a little bit higher. A healthy vaginal pH is 3.8 to 4.5. Oh, wow. It's incredibly higher. So when blood is introduced to the vaginal area, you're suscepting yourself to, more increased irritation, symptoms, higher propensity to have an infection because of that, decreased healthy barrier. The acidity creates a healthy environment for those protective vaginal epithelial cells. So, while menstruating, increasing iron intake, and you said hydrating are 2 good habits.
Oh, yeah. Well, hydrating all the time is a great habit. Okay. Yes. We want to constantly be flushing our organs. We want to constantly be keeping things moist. We want to, adequately hydrating also improves our energy levels. Sometimes you have that headache or that slump at 3 o'clock, and that's not likely that you need a coffee. It's just that you're probably dehydrated. And by the time you feel thirsty, you're already dehydrated. Mm-hmm. So, I think that one thing I always say to when I give talks or lectures or speak to a group or to my individual clients is, if you walk out of here with nothing else, I want you to meet your hydration goals, because you will feel dramatically different.
Right. Incredible. I mean, just general things that you can find on a website, like, drink more water, but to really understand the impact of your flushing your organs. And this is one more thing. We've had so many different awesome things come up. We have members on Prende who intermittent fast, not anything to do with their vaginitis, but just because that's what they want to do. Mm-hmm. Can you speak a little bit to that, the effect of intermittent fasting on inflammation and some of the important factors and processes we've talked about?
Absolutely. So my concern with intermittent fasting is that some people use it for the wrong reasons, right? So they use it because it's really easy for me to not eat in the morning because I'm really busy and I don't think about it, and then I get to work and I just wait until I eat lunch, right? So and I'm saving those calories because I'm not really hungry, so then they're eating lunch. But what happens is our body wants the amount of calories that it wants. So I call these, then your body will make up for calories it hasn't had in inopportune time. So you can fast from, starting at 12, break your fast at 12 and then eat until 11 p.m. while you're watching Netflix and snacking away, because that's easy and fun and great. But that's not when your body really needs its energy, right? So I always say, if you're intermittent fasting, that can be wonderful. For women who are still menstruating, I really don't recommend going more than 12 to maybe 14 hours. For women who are in menopause, you can go 14 to 16 hours. But for our hormones, it's really more stress on the body if we're trying to push for those 16 hours and we're still menstruating. So I also say the goal of intermittent fasting is to eat with the sun, right? Nobody wants to hear that, because nobody wants to eat dinner at 6 o'clock and then watch TV and not eat, right? Or not go out with their friends because, it's past their eating window. Yeah. So it's hard. So if you are intermittent fasting for all of the health benefits, like the autophagy and the cleaning your cells and the decreased brain fog for some, then you really want to be doing it the right way, and it's to eat with the sun. So I would say, eat breakfast, eat your lunch, eat your dinner, and then stop eating at night, because, nobody really needs more nutrition at 11 o'clock.
Okay. Yeah, it's something. I actually was intermittent fasting during COVID times. I had gone home from university. I had full control over what I was eating for the first time in a while, because, the dining halls were cooking for me. I wasn't cooking for me. And for a part of it, it felt very bad. And then I, kind of changed when I was eating. I was having, apples and peanut butter around 8 o'clock, and throughout the night felt super satiated, so that I wasn't, binging at midnight with a big, bag of popcorn, because I was so hungry from the beginning of my day where I didn't eat anything. So I really think that that's an important point to just remind and empower people that are intermittent fasting to remember. It's just it's not about necessarily the calories or restricting calories.
It's not. the whole thing about intermittent fasting is not about restricting calories. It is about eating your caloric needs in your eating window. Yeah. For some people, they use it as a calorie restriction because if they say, I'm done eating at 10 p.m., then it's a rule and they won't eat well, right? So they can do that, but it will not give you any benefits if you're not meeting your caloric needs and your nutritional needs in that window. So I think the takeaways from this is if you are menstruating, right, doing more, like less is more. So 12 to 14 hours is enough. You're getting all the goals, like hitting all the goals that you need. Because all the research that's done on intermittent fasting is done on men, right? And they consider women little men, but we are not little men. We have lots of different hormones and processes going on in our body. So that's why when you are in menopause and your hormones are different, it's okay to go for longer fasts because your body will not be as stressed. But when you're younger. So I think that that's a really important takeaway.
Yes. I'm so glad I asked that follow-up question so we could get to that point because it comes up in so many, women haven't been included in clinical studies. I think it was 1993, 1992 that women were first included in clinical studies in the United States. So we're definitely making up for lost time as far as trying to understand the science behind it. Yeah. Well, Amy, it's been so incredible. I think we unlocked a lot of really great information, nutritional information, general information about how people can treat their bodies to feel better and take a perspective of how to reduce symptoms. I guess as we, wrap up the podcast, what are 3 of your favorite snacks, foods that you like to recommend to people to kind of crowd out what they're eating that's more processed sugars?
Absolutely. So 1 is water, right? Okay. And it's not a food, but if you are hydrating appropriately, your hunger is going to decrease for all the other things that you don't need. 2, I really like to recommend Greek yogurt. So unsweetened, right? So plain, not fat-free, never go fat-free dairy. So, 2%, a 4%, a 5% Greek yogurt. Why I love to recommend it, 1 serving of Greek yogurt has 14 grams of protein. So if you have that for breakfast with some fruit and, and some nuts, that's a great breakfast, but also could be a great snack. And it is widely available, right? You can get it pretty much on any corner now in the airports. Okay. So it's a really good, accessible 1-ingredient snack. Packaged, right? So it's a good packaged food. So that's 1, what you said before, apple and peanut butter, apple and nut butter, or, banana fruit. Again, it comes in its own casing. You can grab it anywhere. It's a whole food on the go. So I don't know if I can say, 1 snack for that, but I would say fruit and some nut butter or seed butter if you're allergic to nut butter is another great snack that I like to recommend. And then I always say, go for something that you can make at home and then have packaged to go, like a chia pudding, which is really fun to do, or, you can make a smoothie and take that to go. So those are some of my go-to snack wraps.
Incredible. And super easy to grab or make or buy. And if it's a banana, one of the cheaper fruits in the store.
They sell them at 7-Eleven now, right?
Yeah.
And another one, I'll just throw in an extra bonus one is if you can eat eggs, I think eggs are the perfect food if you like eggs. Okay. The yolk is a must because it's got choline, vitamin D, all the good stuff. Okay. And they now sell hard-boiled eggs, everywhere from rest stops to Starbucks, right? They're everywhere. So 2 eggs is giving you loads of nutrition, balances your blood sugar. It's pure protein, has all the essential amino acids. So that is a great snack on the go. I
love that.
Yeah.
We'll put that in our back pocket.
Yes. Well, don't, because you'll squish it and it'll smell.
But yeah. Awesome. And where can our viewers learn more about you, keep up with you, Instagram? Where's the best place?
Yeah, so my website is www.realnutritionnyc.com, and I'm most active on Instagram, which is simply @realnutrition.
Perfect. Yeah. Well, then we'll link all of that below so that everybody can keep up with you, keep up with your suggestions and your advice. And it was a pleasure to host you today, and thank you so much for helping us and for helping the people that are struggling with chronic vaginitis.
Happy to be here. Thank you.